Hello, everybody. This is Tenessa Pinkerton, nurse practitioner with SSM Health St. Anthony's, again here today. Today's talk, health talk here, is going to be about diabetes. I know that's a topic of great interest for many of us. So let me get these slides pulled up for us. So the discussion points for today's talk, we're going to do a basic overview of diabetes. We're going to go over some facts and statistics, some risk factors, symptoms, prevention, some management tips, as well as I've put some resources out there for you all, and as always, how I can help. So basic overview of diabetes. What is it? Well, it's a chronic health condition affecting your body's ability to turn food into energy. Specifically, we're talking about glucose, or the blood sugar in your blood that needs to be entered into the cells for your cell to make energy. Either your body doesn't make enough insulin, or it can't utilize the insulin that your body does make adequately. There are three types of diabetes. That's type 1, type 2, pretty familiar. Most of us are familiar with type 2, and then gestational. We won't really talk a lot about gestational diabetes today because it doesn't necessarily pertain to a lot of our members. However, there is some historical significance regarding gestational diabetes that I'll talk about later on. Prediabetes is another subject that I really kind of want to go over today. This is where your blood sugar levels are higher than normal, but not enough for a true diagnosis of diabetes. Sometimes maybe your physician might tell you that you're borderline diabetes or borderline diabetic, and that's something that we can often use to refer to prediabetes. In type 1 diabetes, this is where body no longer makes enough insulin. Sometimes either this means that that your pancreas is completely no longer functioning, or maybe it's functioning but it simply doesn't make enough insulin for your body to survive. It is thought to be caused by an autoimmune reaction, specifically related to viral infections, where the virus makes you ill, and then your body actually ends up attacking the pancreas itself due to that illness. Hereditary factor is pretty significant here. We do see definitely that there is the potential for it to run in families. It's usually diagnosed in children and adolescents, although we do see it in adults as well. Unfortunately, for type 1 diabetics, there is no prevention, and there's usually no warning that it's going to pop up other than the hereditary factor. For type 2, this is the one that most of us are all familiar with. It is where your body makes insulin, but it doesn't use it efficiently or adequately enough to regulate your blood glucose levels. This is usually, you'll often hear us say that your cells are resistant or insulin resistance. That's pretty common with type 2. In type 2, your pancreas can start to diminish function, and where you start to require more insulin, but not always. It does develop over years. It's usually adult onset, but we are seeing children and teens every single day being diagnosed with type 2 diabetes. It can be prevented, and hopefully we'll learn a little bit more about that today. And then gestational diabetes, when I said earlier I'd speak about that, the main thing that we need to know and be aware of with this is that it is pregnancy related. For our members, and this talk specifically today, mainly that it increases your risk for developing type 2. If you have a history of having gestational diabetes, it increases your risk of developing type 2 diabetes later on. So some facts and statistics. Over 34.2 million U.S. adults have diabetes, and 1 out of 5 don't even know that they have it. The number of adults diagnosed has doubled over the past 20 years. Now, that's pretty significant. That's a very large aspect of our population. And then of those people, for only, for 1 out of 5 to not know that they have it is pretty significant. It is the seventh leading cause of death in the U.S. It's the number 1 cause of lower limb amputations, kidney failure, and adult blindness. And unfortunately, over 90 to 95% of all cases of diabetes are this type 2 diabetes. Although it's not necessarily thought of as to be the extreme type of diabetes, as type 1 is often thought of, it is just as detrimental. The reason that it's the 7th leading cause of death in the U.S., you've heard me speak about hypertension and things like that before, and diabetes is fairly similar in the way that it affects your organs over time. So you end up with things like kidney failure, limb amputations, you can die of infections easily. It's very detrimental if it's not controlled. It is responsible for $327 billion annually in medical costs and lost wages. The medical costs for diabetics, unfortunately, can be double the cost of those who do not have diabetes. Another fun fact for this month is that November is actually National Diabetes Awareness Month. Risk factors. Type 1, unfortunately, there's no known prevention for that, but there are risk factors. We talked about the hereditary aspect of type 1. So what I would say here is that it's important, the prevention for it is to know your family history and to also know the symptoms of type 1 diabetes, so that if you start to develop any symptoms, you can be aware and alert your physician and get it taken care of quickly. On type 2, there's several risk factors for it. Being overweight, 45 years of age or older, although again, remember we are seeing many teens and even young children who are developing type 2 diabetes. If you have a history of pre-diabetes or gestational diabetes, or if you've given birth to a child or infant over 9 pounds, those are all risk factors. Also, having a sedentary lifestyle, and in particular participating in physical activity less than about 3 days a week, couch potato, so you speak, and sometimes it's not really even couch potato, it's just that what we call sedentary lifestyle, where you're just simply not out and you're not regularly active. Having a first-degree relative with type 2 diabetes increases your risk. That's siblings, mom or dad, even grandma and grandpa can definitely, having those relatives having diabetes can increase your risk. Also, heritage and specific African American, Hispanic, Latino American, American Indian, Alaskan Native heritage, as well as some Pacific Islanders and Asian Americans are at increased risk for developing type 2. Pre-diabetes. It is basically has essentially the same risk factors as type 2, so I won't repeat those. Main difference in being is that, of course, you wouldn't have a history of pre-diabetes if you are pre-diabetic. The good news overall, though, is that both pre-diabetes and type 2 are preventable, and even pre-diabetes can be reversed with simple lifestyle changes. On next one, we'll talk about symptoms. You see my little donut guy there that says, "Hello, it's diabetes calling." General concerning symptoms for diabetes, and this includes both type 1 and type 2. We'll go over some very specific symptoms that go with each, but these are general symptoms that you could see with either one. Increased urination, especially at night. We also call that polyuria. Increased thirst, unintentional weight loss. And yes, I said unintentional weight loss. Believe it or not, even if you're diabetic, you can have what we call unintentional weight loss. Usually at the very beginning of the onset of type 2, you'll have a little bit of weight loss and think that you're doing great, but actually it could be a sign of diabetes. For type 1 diabetics in children, we will see this unintentional weight loss. You'll see a significant difference in a very short period of time in weight drop in kids for this, and that's usually a pretty blaring signal to us that something's up. Increased hunger, not just because you need a snack, but you're truly hungry, like, man, you just can't fill that bottomless pit. Blurry vision. Also, too, sometimes I've also heard of patients that will have improvement in vision, much like they have the weight loss. They have some weight loss. Their vision actually improves a little bit, and that's actually right at onset of type 2, and then it will kind of come back and actually sometimes even regress if it's not taken care of properly. Fatigue, dry skin, sores that don't heal or heal slowly, frequent infections. For women, that can be frequent yeast infections that just never seem to go away. Or maybe you treat them back to back to back. You get several within a year. That's something to kind of take note of and be aware of. Numbness or tingling in the hands and feet, although this is usually a later sign. This is generally because the nerves have been damaged by the amount or the chronic high blood sugar levels. In type 1 specifically, people will sometimes have some severe nausea and vomiting or stomach pains just prior to onset. It develops quickly and symptoms are usually pretty severe. Juvenile is, or it's called the juvenile diabetes, but again, adults can get this too. Type 2 variations of general symptoms, that's everything that we kind of went over before. It does develop over time, generally several years. It does have the adult onset. However, like we said before, lots of kids, teens, adults, and younger adults are being diagnosed every single day. Prediabetes. There aren't any specific symptoms for prediabetes. The biggest thing is recognizing the factors that put you at risk for prediabetes, and making sure that you have routine screenings. The same risk factor, it has the same risk factors again as type 2, plus another risk factor that I didn't mention earlier for this one is that you can have a history of what we call polycystic ovarian syndrome. So if you've ever been told that you have polycystic ovarian syndrome and yet you don't have diabetes, you may want to really keep an eye out for possibly being a pre-diabetic. If you add being overweight and several other things into that mix, it can definitely increase your chance. So let's talk a little bit about prevention. For type 1, again, there's no known prevention. The biggest thing that I say there is being aware of your family history so that you would know if you have that risk factor, as well as monitoring for any of the symptoms to appear. Type 2 or prediabetes, biggest thing for that is lifestyle changes. I can't preach that enough. Again, exercise, healthy diet, say a weight loss of 5 to 7% of your body weight. So for a 200-pound person, that's about 10 to 14 pounds. That can actually reverse your prediabetes and curb that. Health coaching or working with a trainer to lock in your lifestyle changes. It's great to set goals and start those goals, but many of us aren't really good at adhering to those goals. I'm guilty of that myself. Sometimes it helps to have someone to help with accountability, someone to help with that lifestyle coaching. I'm definitely available to help you guys with that. There's also what we call a diabetic prevention programs. The CDC in specific has one, and I listed the link down at the bottom to that one, and I put it on the resource page as well. Stress management is key. It does increase those cortisol levels, not to mention the fact that if we're not managing our stress well, maybe perhaps we're not focusing on the rest of our health either, and so everything just kind of takes a domino effect with that. Support is really important. That's the groups or maybe even individualized coaching. The CDC has the diabetes prevention programs that I mentioned before, and there's several opportunities here at the center as well. And then again, the CDC recommends recognized national diabetes prevention programs, and there's a link there that you can go to that you can actually look up the ones that are available here in Oklahoma. I think Harold Ham has one. I know that through SSM we don't have a diabetes prevention program, but if you were pre-diabetic or you had some obesity that we needed to address and you needed some individual counseling, we could refer you to a registered dietitian to kind of help with that as well. So some management tips. Proper management of diabetes can prevent or delay several health complications, and that's really kind of the overall goal in the management of diabetes, is to keep what we call that end organ damage at bay. Common complications of diabetes, and this is both type 1 and type 2, heart disease, kidney disease or failure, nerve damage, digestive nerve damage, also called gastroparesis, sexual problems, bladder problems, specifically frequent UTIs. You can also have some neurogenic or some nerve-related bladder problems as well. Limb amputation, dental disease, hearing loss, and vision loss. Routine exams and screenings are extremely key in management. I really can't stress that enough. Good follow-up with your physician, whether you're seeing an endocrinologist or your primary care is managing your diabetes. Make sure that you're adhering to the recommended follow-up visits for that. Also, we say ABCs, that's the A1C monitoring, blood pressure. Remember, we want that 130/80 or less. Controlled cholesterol levels, and definitely stop smoking, or don't start if you have the opportunity now. You want to monitor your blood glucose and keep your levels as close to target as possible. I recently went to a virtual seminar regarding diabetes education, and just to try to put this into perspective of how important it is to know what your blood sugar runs. Even if you're just on the metformin by itself and you're only checking your blood sugars maybe once a month, it's important to kind of really know what your blood sugars are actually doing on a routine basis, so that you can make sure that your diabetes is well controlled. The A1C does a good average over 3 months, but it's not going to give you the constant ups and downs that you might run, so that you can see. Remember, if you have 300 and 100, you're getting in an A1C, you're getting an average of that, which is, still definitely a good tool for us to use and gauge some control by. But if you're going really high and really low, that doesn't really reflect good control. So checking your blood sugars and keeping a good close monitoring on them is important. Again, to really kind of support that, for every 1% decrease in your A1C, so if you had a A1C of 8 and you went down to 7, you can actually potentially decrease your risk of complications by 25%. So imagine if you went down 2 points, if you were 10 and went down to 8, by really monitoring your blood glucose levels and making sure that you were staying within the range that you need to be. If you brought it down even 2 points, that decreases your risk of complications by 50%. So really knowing where you lie, keeping track of your A1Cs and knowing what you're at least a gauge of a few days at a time, up to a week at a time, just to look and see how your blood sugars are ranging. That can help you to kind of motivate yourself to really stay within range. Then you can actually decrease your A1C, or at least keep it at the desirable level. We usually say 7 or less is where we'd like for you to be if you've already been diagnosed. Regular physical activity is extremely important. Remember, exercise. I think I'm going to have to say that it almost cures everything. It comes up on every single talk that we do. It's very important. It has extremely beneficial outcomes if you start doing that, and great results. Also maintaining a healthy weight, that kind of goes hand in hand with regular physical activity, but also good dietary choices as well. Foot checks are extremely important. I recommend daily foot checks at home, as well as at every healthcare visit if you've already been diagnosed with diabetes. Some people, unfortunately, what they don't understand is they will start to lose feeling in their feet and not be aware of it, obviously because you can't feel it. But it's important to check for sores, important to check for anything that might be abnormal. And then when you're at your physician's office, so that they can see from visit to visit, have you lost any sensation in your feet? Have you not? Sometimes we only do those annually. Sometimes we do them every 6 months. But usually if I have a diabetic that I'm seeing, I like to see your feet too. That way I can check for sores and anything that you might have missed. Also, regular dental checkups. Again, when we said frequent infections, not always just yeast infections, things like that, but sometimes it has to do with poor dental hygiene. Not always, but sometimes not being able to, poor healing, or just not. I'm sorry, I got stuck. Poor healing, or just actually, and even if your intake, the high levels of sugar can actually compromise your dental health. Annual hearing and vision exams are extremely important. You may say hearing, and yes, that's actually true. Why? Because having high blood sugars for an extended period of time can actually affect the nerves that are responsible for your hearing. In addition to that, vision exams extremely important. Sometimes the physicians or the optometrist or ophthalmologist can actually see changes during your vision exams that would reflect how your diabetes is progressing before any other obvious signs or symptoms that we would see would happen. And so they can kind of help head that up and make sure that we can take care of that if they see any big changes. So another important management tip, and again, I really can't emphasize this one enough, diabetes self-management education and support. We call it DSMES. This is shown to have or be statistically significant decrease in your A1C levels if you adhere to one of these or join one of these. This isn't always something that you need to do every single day. Sometimes it's for a short time period. Sometimes it's longer. There are several different education opportunities and facilities available, and I put a link to those in the resource slide. SSM Health St. Anthony's does actually have one of these. It is let's see if I can It is an ADA accredited. I put the phone number as well on the back on the resource page. I always like for my diabetic patients to have a registered dietitian consult at least once during their course of diabetes, and possibly some rechecks from time to time if it's needed, and revisit it as needed. Also, mental health, again, is extremely important. Like I mentioned earlier, increased stress and depression can contribute to poor diabetes management, and we don't want that. So it's important to take care of yourself, mind, body, and soul for sure. So some resources that I listed, specifically diabetes education, and there's a link for you to find different programs there. And then we've got the Diabetes Self-Management Education Department at SSM Health. That's the phone number to call. You do usually need a physician's referral for that, but you are most welcome to always call and say, hey, what do I need to do? This is what I would like help with. And they can get you directed to what you need to talk about with your primary care. Or the next time that you're in and seeing your primary care provider, say, hey, I've been a long time ago, or maybe you've never been to a diabetes self-management class. Ask your primary care provider about it, and you guys can actually have that conversation and decide who's closest to you and who could benefit you the best. I do know that Clyde's Pharmacy, that is nearby, also offers a diabetes self-management education course. They are certified as well. There is the Diabetes Association, American Diabetes Association, that's the diabetes.org. And then again, a list of the self-management education from the CDC. I will say again, this helps to learn how to control your A1Cs, to really manage your blood sugars on a routine basis. These folks will really help go into great depth and detail to help you to manage your diabetes the best that you possibly can. The quicker and more routine that we keep your blood sugars at a lower and consistent level, then the less risk for complications that you'll have. As always, how can I help? Again, anything that I can do, primary care, or if you have a question that you want to stop in and ask me, feel free. If you'd like to know a little bit more about your diabetes or where you need to go or who you need to talk to, you're most welcome to make an appointment with me, and I will be happy to guide you through that. All references always available upon request. And eventually I'll get quicker at navigating all my buttons. Thanks for joining us today. I hope this helped you out a little bit. If you have any questions, always feel free to stop in and talk to me at any time. Thanks, and y'all have a great day.